Well, doctors say patients are being forced into a stressful competition when surgery phone lines open. The body that represents GPs is now calling for investment to improve access. Here's our health correspondent, Jenny Rees.
Good morning, West Key. Jo speaking. How can I help?
Early morning at West Key Medical Centre in Barry, and the phone lines have just opened. For now, appointments are still available, but with 22 people in the queue and over 1,000 calls received, the demand is high.
We're seeing between 9,000 and 10,000 calls per week. We're only able to answer around about 2,000 calls. We just don't have the capacity to take the sheer amount of calls which are coming through to the surgery every day.
Increasingly, it's harder and harder to say, please bear with us, and phone the next day when there isn't. They phone the next day and to be told the same thing again and again and again.
Staff say some calls have turned abusive. One was told, "If I die, it'll be your fault." West Key holds monthly meetings with patient representatives to feed back suggestions for improvements. Jo Cottle is among those. She sings the praises of the surgery, but knows others elsewhere also struggle.
You're waiting maybe in pain, in discomfort, and by the time you sort of get to breaking point, then you get an appointment. So you've had some unnecessary, discomfort.
A lot of what we worry about is the right type of conditions and patients getting through to us at the appropriate time.
The Royal College of GPs says funding is needed, more GPs and better booking systems.
Obviously, we know there's a shortage of GPs, and hence we've recruited other key clinical staff in order to try and compensate for that, really.
Among them is Rachel, one of their advanced nurse practitioners.
A GP can do sick notes and certify death, but other than that, advanced nurse practitioners are able to do pretty much everything that a GP can as well. Being able to access healthcare from different healthcare providers that can provide a very good standard of care as well will definitely help patients.
It's not just who, but how that care is given. In Wales in the last year, telephone consultations have risen from a fifth of all appointments to half, increasing the numbers available.
We know we can deal with most stuff over the phone, but it's getting that confidence over to patients that that's not a lesser quality consultation, and it will always be followed up with a face-to-face if we feel that it's needed.
The Welsh Government says there's been a significant increase in GP training places in recent years, and they're looking at ways for technology to improve booking systems.
Still to come,